I'm just curious to get your thoughts on where you stand with something like antibiotic toxicity, because I do know they do have their place. They're not all evil, but I do know they do cause some problems, especially when it comes to microbiome health.
So let me break it down to two pieces. I treat a lot of patients who suffer what's called Cipro or ciprotoxicity or floxing, which is a group of medicines called fluoroquinolones. Cipro, Levaquin, Avalox are probably the three big ones out there now. They're everything from in eardrops to for urinary infections. And at least 25% of the population are really sensitive to it and have side effects from brain fog to neuropathy to all these different side effects, including tendon rupture. And it's been a black box warning on medicine, I think, since 16 or 17 at least. So about 4 or 5 years now. So that's a group of medicines that I specifically deal with in terms of antibiotic. And I've learned how to treat patients with. I probably treat there's probably a group of 5 or 6 of us who treat a lot of the patients who unfortunately suffer with. That's one thing. That's a specific illness. Antibiotics in general, I am a proponent for certain things. And then there's a lot of good herbals for other things. So I think you need, again, that's why I like the fact that I can play on both sides of the fence. A couple of quick things I kind of highlight. I have patients who have Lyme or H. pylori, which have numerous effects in both cases. And I kind of break things down to the patient and say, look, you may get treated a little slower, but there's this herbals that are pretty close and they've been studied. And then if they understand that it may be a little bit slower, but you may not have the side effects of the antibiotic, then they go for it. So that there are other things. Example is SIBO, where there's an antibiotic called Xifaxan, which has great studies. It's minimal toxic and it has pretty good efficacy. I'm probably going to lead towards that if the herbal doesn't work. So it's knowing the data behind it. So I'm just not, oh God, antibiotics are bad. Should a patient be, but it's also the flip side of, I've had patients come in for headache. It's not a good example, but conditions where they've tried 4 different antibiotics and it's not working, and they've destroyed their microbiome and their gut health is not good, and it may give them a little bit of brain fog. Then it's like, okay, no, we got to flip the paradigm here and let's try some herbals or red light or peptides or an IV. It's kind of all over the place. I think there's definitely a place for antibiotics. I think they're overprescribed. I think you need to understand the issues that you can have with them. I think, unfortunately, the traditional medical community is very anti-supplementation or other things for the things that they're just giving antibiotics for. And I think the last thing, without getting on a soapbox, is unfortunately it's part of our medical culture now where doctors have like 6 minutes to do with a patient. It's much easier to give them an antibiotic in those 6 minutes than to try to figure out the cause or discuss supplements or whatever else they can do to fix the problem. So I think that it's a really big rabbit hole. And I think if your doctor's only giving you antibiotics and not giving you a full treatment plan, then it may be time to switch doctors if you're not happy with it.
Yeah. Yeah. And even the CDC has come out and said, hey, stop prescribing so many antibiotics. It's, I think it's like 60 or 70% of the antibiotics prescribed in the US are completely inappropriate.